Good evening, one and all. Myself, Dr. Rupasri. You all know, and I'm a consultant in obstetrics and gynecology, Hyderabad. Okay, let us discuss the topic hematological changes in pregnancy. There will be some values from where it will start, where it will end, how much percentage it will be raising. The students will be having some of the difficulty in understanding this topic. So let me explain it clearly so that you will be answering more amount of MCQs. Okay? Okay, let us start. Okay, in hematological changes, first we have to know some of the conditions like blood volume, plasma volume, and next is the RBC and the hemoglobin from how much it will raise and when it will end. Okay, let us discuss the first point, that is blood volume. Blood volume. It starts to rise at 6 weeks and ends at 32 to 34 weeks. Okay, rises up to 50%, almost 40 to 50%, and the reason is because of the enlarging uterus, growing fetus, and placenta. Okay, for this condition the blood volume will be raising. Okay, and the next is plasma volume. Okay, it also start to rise from 6 weeks, ends at 32 to 34 weeks, rises about 50%, and almost the volume increase to 1.25 liters. Okay, 1.25 liters. And the third is the RBC and the hemoglobin values. It starts to rise at 10 weeks, continue till term, rises about 30%, and the volume increases is almost 350 ml. Okay, they'll give so many big lines in all the textbooks. No, you follow simple rule from where it starts, where it ends, how much will it increase, and what is the reason behind it, why it is increasing. Okay, now see, the plasma volume increases by 1.25 liters, but the RBC or the value increases only by 350 ml. So what a difference in this. See the huge difference. Okay, so it results in physiological anemia. Anemia in pregnancy. Now you understood the reason now? See, the plasma volume increases by 1.25 liters and the RBC by 350 ml. So this difference leads to the physiological anemia in pregnancy. Okay, the important questions which can be asked are from where it starts, where it ends, how much value will increase. If you have an option, take 32 weeks, it is more appropriate. Okay, how much it will increase, how much the RBC will increase is the question, 30%. Okay, next. Next coming slide we'll discuss regarding the physiological anemia, that is hemodilution. Because of the difference of the plasma volume and the RBC, it results in hemodilution. Hemodilution. By term, the hemoglobin percentage falls by 2 gram percent because of hemodilution. Okay. Now the first important point is, what are the advantages of hemodilution? First point. Because of it, what happens is the blood viscosity. The blood viscosity decreases and it helps in easy exchange of gases between the mother and fetus. Second point, it protects the mother from supine hypotension syndrome. And And the third is, okay, supine hypotension syndrome. It prevents the blood loss during delivery. Okay, so what is hemodilution? Because of the difference between the plasma volume and RBC, it results in hemodilution. How much the hemoglobin will be falling? 2 gram percent. It is a question. Okay, it is an MCQ. By term, how much? Average on an average 2 gram percent. Every pregnant lady will be losing. And what are the advantages? See, I have written here 3 advantages. Means the possibility of giving the question. All are true except, okay, only one is correct. Like that, they will be asking the MCQs. Therefore, advantages are decreased blood viscosity, protects from supine hypertension syndrome, and it prevents the blood loss during delivery. Okay, now coming to the next slide. Okay, we'll see about WBC and immunity in pregnancy. First point. In pregnancy, WBC increase, especially neutrophils. Okay, it increased from 15,000 per cubic mm to 20,000 per cubic mm. Okay, why? Why it will increase? Because of increase in estrogen and cortisol levels, WBC increases. Okay, now the next point. Actually, the T cell immunity in pregnancy shifts to B cell. It is a passive immunity. It shifts to B cell. Okay. Now we'll discuss about the plasma proteins. Okay. Normally in pregnancy, plasma proteins increase from 180 grams to 230 grams. Okay. But because of hemodilution, hemodilution, the plasma protein concentration decreases from 7 gram percent to 6 gram percent. Okay, it decreases. Because of this, what happens is, because of decrease in plasma proteins, the blood viscosity and what happens? The colloid osmotic tension decreases. Osmotic pressure decreases. Okay. And the albumin to globulin, normally it is 1.7 is to 1. But in pregnancy, albumin to globulin is 1.1 is to 1. Okay. See, in pregnancy, WBC count increases, but what happens is because of the rise of estrogens, cortisols, neutrophils will be rising. This is a question. Okay, and T cell immunity shifted to B cell immunity, that is a passive immunity. This is the question. And plasma protein concentration decreases. Mostly they will be asking because of the decrease of the plasma proteins, what happens is the blood viscosity decreases. Okay, colloidal osmotic pressure decreases. And albumin to globulin is normally 1.7 is to 1. But in pregnancy, because of this, it is 1 is to 1. Okay, next. And the last we come here is blood coagulation factors. First point. Okay, in blood coagulation factors, the platelets decrease in pregnancy because of consumption. It is known as gestational thrombocytopenia. Okay, and pregnancy is a hypercoagulable state. If we remove this much blood, now it will get clotted. That's that much hypercoagulability state a pregnant woman will be having. Okay, fibrinogen level rises by 50%. Normally it is 200 to 400 milligram per deciliter, but it changes to 300 to 600 milligram per deciliter. Fourth one, ESR is raised. And last, the blood coagulation factors. Blood factors, coagulation factors, which increase are 1, 7, 8, 9, 10, which unchanged are 2, 5, 12, which decrease are 11 and 13. Okay, all the coagulation factors come to normal by 2 weeks postpartum. Okay, this is a simple slide. You will remember each and every point. See, what are the questions that can be asked here? See, pregnancy is a hypercoagulable state. All the platelets will decrease and it results in gestational thrombocytopenia. What all are increased? Fibrinogen levels are increased by 50% is the question. ESR is increased. Blood coagulation factors may. And what all coagulation factors which decrease are 11 and 13. In last 10 years papers, if you observe all the questions, this question will be present almost 4 to 5 times. That much important. What are the coagulation factors which are decreasing? 11 and 13. 11 and 13. What are the effects of this decrease in the 11 and 13 factors? They'll be asking. They'll give a big line and they'll give a small point that the factors like which are decreasing, that is 11 and 13, because the patient will be bleeding. Okay, and by what time all the coagulation factors will come back? It's about 2 weeks. Okay, I think this is very simple explanation that you can remember more points. Okay, and it will be helpful to your in your MCQ pattern. Okay, thank you.